you. I am going to share. Y'all tell me if you can see that.
Yep, you
Yep.
just want to put it in presenters mode and you're good to go.
Going. There it goes. How's that?
Perfect.
Perfect. Good. Well, first of all, thanks for the invitation. I know LeAnn's on and want to thank her for the opportunity to be with you all today and have this conversation. I'm Trista Piccola. I am newly minted in the Aetna CVS Ohio Rise program, but I have spent a number of years as a social worker in Ohio and other parts of the country, Virginia, New England, Arizona, Wisconsin. So been around a little bit, but my home and my heart has been in Ohio, not new at all to working with kids that have more significant difficulties throughout my career, and was really thrilled when this opportunity came along to work with the Ohio Rise program because it brought me back home to where family and friends are, and also to some really critical work. So I'll let Krista introduce herself.
Hi, good morning. I'm Krista Delaney. I am an LISW and I am with Aetna Ohio Rise as well. I am the PRTF clinical administrator. I have experience working in a PRTF in another state, Kentucky. I also have experience in hospital social work. I see a colleague from Akron Children's Hospital on the call, as well as school-based social work and children's advocacy center work. I've been with Ohio Rise almost since the beginning, back in the summer of 2022, and have been with PRTFs in Ohio since they launched almost 2 years ago. So excited to be here to present with you all today.
LeAnn, you want to make a quick appearance with who you are?
Yes. Hi, everyone. LeAnn Magre, and I am also an independent social worker. I have done the majority of my practice in Kentucky in the child welfare system of care, as well as working with families for preservation services. I also ran one of the very first psychiatric residential treatment facilities in Kentucky back when they started well over 20 years ago. I came into Ohio Rise through the Aetna managed care system to support the work that was being done in Ohio Rise. Part of my career has been part of providing care coordination and following a wraparound model. And because of my history and background, Aetna asked me to come and help in Ohio, and I have been thrilled to be part of the Ohio Rise process for the last 3 years. And very excited about the work we are doing in PRTF, and very excited to share with you the directions that we're going today. So thank you for having us, and I look forward to any questions or concerns that you all may have. Thank you.
Hey, so we will keep it moving. See if the slide will advance. He's not moving. Not sure why he's not moving, guys. Oh, there we go. Oh, there it goes.
Never mind.
Yep, sorry about that. Yes. Maybe it's just the slowness of the computer. They warned me about that. So yes, psychiatric residential treatment facilities. I don't know how many of you on the call, some of you, it sounds like maybe a bit familiar with this particular service, but it is a specialized treatment for youth who have chronic behavioral health needs. And it is different from acute psychiatric hospital stays, which are really meant to stabilize kids who are in acute behavioral health crisis. Now, when we talk about some of the youth that are served in PRTF, we'll talk a little bit about how there are times when they may become dysregulated in a PRTF setting and need to go for a short hospital stay. But the idea is to stabilize them and bring them back to a treatment setting. One of the things that we're working really hard on in Ohio is to talk about PRTFs as a treatment and not a placement. If you've worked in the residential space at all, we know that we have situations where kids can get stuck in something that becomes a residential placement for them. And so we're moving along with that conversation, but we've got more work to do to make sure that kids who reach this level of service because they need this type of treatment receive the treatment that they need, and then they are stepped down to their next best option, whether that's family or some other type of care. It is one of many services on the continuum of care that LeAnn alluded to. We have a lot going on with Ohio Rise, everything from very low-level care coordination in communities to more highly intensive wraparound services, to other kinds of multi-system youth involved care, and then all the way up to PRTF service. This service did not exist in Ohio prior to Ohio Rise coming along. It is long overdue. I think the last time I looked, 34 other states, or 34 states total, including Ohio, have at least one PRTF. And again, just to emphasize, it's one service on a continuum of care that it takes for a really thriving system of care to work. It was developed in Ohio with the Ohio Department of Medicaid, along with the Ohio Department of Mental Health and Addiction Services, and a whole host of other people who have such a strong interest in making sure that our kids are getting what they need, all the way upstream in terms of those prevention services and care coordination that we referenced, again, all the way to the higher level of services. So as you can imagine, there's a lot of people who are interested in making sure kids and families get what they need, and they were all brought to the table to provide feedback as Ohio Rise was being developed. But PRTF certainly surfaced as one of those really strong service needs. So PRTFs are designed to provide active trauma-informed treatment at an inpatient level of care. So kids do go to a campus and they stay there. We'll talk a little more about Ohio's model for PRTFs that very much involves families and care planning, and having family and youth voice be at the center of the kind of treatment and care that our youth are receiving. But all of the PRTFs operate under the direction of a physician. It is, as I said, 7 days a week, 24 hours a day, and it's really designed for youth who are under the age of 21 who have those really complex behavioral health needs. There is a medical necessity determination that has to be made by the plan for any youth to be authorized to enter a PRTF. There's a number of things we would want you to know about a PRTF as a service. So again, daily active treatment that happens inclusive of the family, the guardian, caregiver. It includes a lot of different types of therapies depending on what the youth's needs are. We do a lot of conversation and consultation with our PRTFs to determine what are the services that that particular youth needs while they are in treatment at the PRTF. It is a highly structured environment, but that doesn't mean that it doesn't customize, they don't customize services to meet an individual youth need. I said before, at the heart of this is really being trauma informed. While not all of our youth have significant trauma histories, the vast majority of them do. And that's not a criticism or an indictment of any family that's trying to care for their youth who has complex behavioral health needs. But we also have youth who come from the child welfare system who also have complex trauma histories. And so it's really important that our PRTFs are attending to their trauma needs and making sure that the therapies and the services that they are providing are designed around that. We've talked a lot about it not being a placement, but a treatment. And we're working really closely with our PRTFs around what is the best practice for a PRTF service. How long should kids actually stay in a PRTF? There are some best practices. There's some literature that suggests around 90 days, but certainly a 6-month time period where kids will reap the most benefit from being in this type of treatment service. Again, knowing that all kids are different and we really want the service to be customized around their needs. But what we find is the longer youth stay, the more difficult it is to get them transition back into their community, back to the family. It is a youth and family driven service. Bringing youth voice and family voice to the table is so critical. Krista will talk a little bit more about the child and family team that really surrounds the youth before, during, and after they have a PRTF service. And again, we talked about the medical necessity that is needed before a youth is able to be admitted to a PRTF, and that's something that our staff at Aetna are regularly going back to make sure that medical necessity is still met. Youth who are referred by the plan, who meet the admission criteria, we first look at our in-state PRTFs, of which there are 3. And again, Krista will talk a little bit more in detail about them. But we have youth that the plan places in both our in-state options, but also responsible for placing youth out of state. So Krista, we're going to move to you.
Excellent. So Ohio joins 33 other states in the U.S. who do have this PRTF service. Again, Trista and LeAnn and I have worked in other states where PRTF has been established. So I was very excited to hear that PRTF was coming to Ohio with Ohio Rise. And we're currently in the process of building our in-state capacity. PRTF has been a service that Ohio Rise has funded, has paid for. However, that has involved youth going outside of the state of Ohio in order to receive that level of care. We all know that that's not ideal. That's not where kids need to be in order to heal. They heal best when they're with family. And having them in a PRTF treatment facility that is in their state, or in their community, hopefully that helps them return to the community and to their family as soon as they can do so. So having in-state capacity for PRTFs, this does support the overall system of care. It's another level of service in the overall continuum of care, where it's we have inpatient behavioral health treatment. We have very local level care coordination that's happening, and PRTF does fit in that continuum of care. We hope to shorten inpatient lengths of stay by getting youth out of the hospital who do not need that level of care but do need an intensive service. PRTF helps us to do that. It also helps to, we are in the process of reducing the number of young people who have to go outside of the state in order to receive this service. Also, having PRTF here in Ohio helps to address the behaviors and needs that are happening for that youth and their family so that they can return home. This is not, as Trista spoke to, inpatient hospitalization, which is really for that crisis period. This is for figuring out what's going on at home, connecting skill building that they're doing in the PRTF to skills that they will continue to build and grow on when they're back with their family or caregivers in the community. Ohio is specifically building capacity for 2 kinds of PRTFs, and this is for youth between the ages of 6 and 21. So we have our general behavioral health care needs. That will be the majority of the PRTFs that we have that are in service delivery now and those that are in various stages of readiness. We also are going to have specialized and do have specialized PRTFs for young people who have co-occurring mental illness and intellectual disabilities. And when actually, I think it's 2 slides from now. When we talk about the PRTFs that we do have open, I'll highlight which type of PRTF facility each of these are. Next slide. Just a little bit of the history about how we got to where we are right now with the state of PRTFs in our future state. Ohio PRTFs were selected through a request for proposal process. This happened in the summer of 2023. And our PRTF services are gradually becoming available as the providers who were selected through that RFP process go through all of the necessary steps. Licensing, contracting, getting all of their policies and procedures in place, making sure that the actual physical location where the PRTF service will be delivered is safe and is also it's a home-like setting for youth. That's one of the differences between PRTF and an inpatient hospitalization is that PRTF is intended to be in a home-like setting to help better prepare youth to return to their community. Over the next 3 years, we will be adding additional PRTFs who were selected through that process. As I'm sure it's no surprise to any of you, we have great intentions of this is when we plan for a PRTF to be online, but things happen with construction or staffing, and those timelines do get pushed out. But we are very excited to share with you about the 3 PRTF facilities that we have open, as well as kind of the future state. We will continue to assess our capacity needs. Right now, we have 24 PRTF beds that are licensed and certified through the state of Ohio, and there's a need for many, many more. Next slide. So currently we have 3 PRTFs that are open for business here in Ohio. Our first PRTF that launched back in November of 2023 is the Buckeye Ranch, and this is at their Grove City, Ohio location on Hoover Road. So if you're familiar with their QRTP and their school setting, the PRTF is there at that location. They are in the process of building a new state-of-the-art facility that will expand the number of PRTF beds that they have. So that's kind of future state for the Buckeye Ranch's PRTF. They have 12 beds that are licensed through the state of Ohio. In February of 2024, Belmont Pines opened their PRTF cottage in Warren, Ohio. So it's not on the Belmont Pines hospital campus where Trista and I just happened to be visiting yesterday, but it's about 25-30 minutes away in Warren. It's actually on the campus of Trumbull County Children's Services in a small separate cottage is where their PRTF is. They have 6 beds in that facility. And then our newest addition to our PRTF network here in Ohio is Belfair JCB. This is at their Shaker Heights campus. They are a 6-bed cottage who is specializing in youth with co-occurring mental illness and intellectual disabilities. So they have a treatment focus of youth who are have an autism spectrum diagnosis. And we have been very excited to add this specialized service to our network. There are great things happening in our PRTFs, and there's more to come. If you go to the next slide, Trista, you're going to take this one to talk about what it kind of takes to become a PRTF in Ohio.
A lot. It is not easy. And so when we talk about it's sort of like I know there's a lot of pent-up demand for PRTF because it's been so needed, and everybody's interested in keeping our Ohio youth as close as possible to their communities and to their families. But it's no small thing to get through the process of becoming a PRTF. So sort of bore you with all of the rules and regulations, but as you can imagine, there are many because, in part because um, uh, being authorized through the Department of Medicaid all by itself is no small thing when you layer on all the behavioral health certifications, and remembering that all of this is really designed, all the rules and regulations are really designed to make sure that a comprehensive service is provided to the youth, that they get better where they are, and that ultimately they're able to transition back to their community. So the first step in the process is really to get to that licensure and certification that gets issued by the Ohio Department of Mental Health and Addiction Services. And then we get to these pieces and parts about the Aetna contracts and agreements, and then enrollment as a PRTF with the Ohio Department of Medicaid, and they are issued then a Medicaid number. Again, all along the way, they are jumping through any number of, I'll call them hoops. I don't mean that in a pejorative way. They're the appropriate hoops to have to get through to make sure that the PRTF service that is delivered is one that we would want it to be and that is of high quality. Aetna completes a pretty thorough readiness review to make sure that even once all of those things are in place, that we go in and we take a thorough look through of, do we have all of the I's dotted and all of the T's crossed before they actually go live. And then we finalize a go live date with them. As Krista said before, we were able to bring 3 online within about a year, the last one being October of 2024. We have a couple more agencies that our best hope is to bring them online by the end of the summer this year. Again, we know that increasing service delivery capacity is one that's a really critical need. We have a growing wait list of kids who need PRTF service, and the sooner we can get our folks up and running to deliver the service, the better the state's going to be, the better the system of care is going to be. Going back to a couple of things that Krista said about PRTFs, and it's not sort of this business as usual model of residential service. And I don't mean that in a pejorative way to those who have been providing residential services, but this is different. And Krista mentioned home-like environment. And sometimes that's one of the most difficult transitions for providers to make, is to figure out, how do we make this a home-like environment, knowing that these kids are coming with some really significant challenges. And also honoring family and youth voice. How do we really, really incorporate them at the table, talking about the treatment, making sure that they have a voice in how services are being designed and how services are being delivered, both before, during, and after services. So Krista, this is yours.
I know that we are running short on time, but I want to make sure that you understand how you can access, or families and youth that you are working with can access PRTF if needed. So when there is an emergent need that's identified in community setting, the CFT is where really the action happens, the magic happens, is that discussion about, is this necessary? Is this needed for this youth at this time? Making the choice to send a child into treatment that is outside of the home, that's a huge decision to make. And we want that to occur by engaging the clinical hierarchy within the CME. So the CFT is discussing, they're bringing in clinicians at the CME to talk about, is this a viable option for this youth? Is this going to help the youth get better? What are some things that we could do maybe instead of that? So creative problem solving. We always encourage and really require there to be concurrent planning happening at the same time that requests are being put in for PRTF. There's also concurrent planning happening to, what can we do to manage this youth behaviors here at home, so that maybe they don't have to go into PRTF, because that is such a huge decision. Aetna and the state can offer technical assistance. and then a PRTF request, it's really a prior authorization request, is made to us at Aetna. And various things happen in terms of utilization management and notification, referrals going out. But what you need to know is that to access PRTF, the child and family team for that youth, the Ohio Rise Care Coordinator, the FCFC, whoever's providing care management services for that youth, that is where that decision takes place, and then the request is made to Ed. Just the next slide.
Yep. This is just us. Here's who we are. Here's our contact information. There's Krista and I. We also have, actually, we have a couple of PRTF coordinators. We've got to put Michaela on here. Didn't update this, but we will go back and do that to make sure she gets credit for being one of our coordinators. They really are critical in making sure that information gets to, whether it's our in-state or out-of-state PRTFs, get information to them when questions get asked. Make sure PRTFs that are considering admission for one of our youth, that they get all of the information that they need to make a really good decision. We have an interim chief medical officer, Dr. Angadi. We will have a permanent medical director who will be starting, I believe, on Monday. Dr. Bruner will be joining us. It's great to have them on because they oversee the PRTF prior authorizations. We have someone, Ashley Bennett, who works directly with our county child welfare agencies and make sure that, again, as I mentioned earlier, some of our youth come from the child welfare system. They're in custody of the PCSA, and we need to make sure that we're communicating with them and providing supports around the youth that they have. And then we also have a clinical escalation team. So there are youth out there that we need to reprioritize for lots of different reasons. Maybe they're sitting in a hospital waiting. Maybe there's something going on with them that they need to rise to the top in terms of our attention. And so we have a team that surrounds them and helps us reprioritize them. So questions? That.
Looks like there is one question in the chat from Aaron. Choosing between QRTP versus PRTF.
Who wants to take this one? Trista, do you want to give a brief kind of synopsis of how one would make that decision?
Yeah, I mean, medical necessity is part of it. I think probably symptomatically what you would see is kids map similarly in terms of need, but medical necessity is really a piece of that. And we are looking at kids that have pretty serious mental health diagnoses. Those diagnoses will manifest themselves in similar patterns of behavior, whether it's physical aggression or self-harm. But really, we have a whole set of medical necessity criteria that we have to take a look at in terms of recent prior hospitalizations, that sort of thing, that we think helps tease apart the QRTP need versus the PRTF need. But we take a look at all of those and map it against medical necessity.
Excellent. Trista, Krista, and LeAnn, thank you so much for presenting today. Appreciate it.